keep their body healthy. And this is just another example about social distancing and how important it is to our seniors, how we are missing important moments where we can be in direct contact, but also knowing who we're fighting for. So just a quick message directly from our healthcare providers that, again, they appreciate the meals, they appreciate the thank yous, but the most important thing we can do to protect these folks is to stay home. You have a loved one that is in the healthcare field, stay home. You have a friend who is in the healthcare field, stay home. You don't have any of that, you're still protecting people, even if you don't know them, that are absolutely critical to protecting the lives of those that you know and that you love. Okay, got a number of updates and or new steps today that we're going to go through before we hit today's report. First, earlier today I recommended to our public school superintendents, as well as a number of private school jumped on as well, that we extend the policy of no in-person instruction through at least the end of Friday, May 1st. This goes along with what the White House put out, extending their guidance through April 30th. We know it's going to be needed for at least this period. And what I told them was we would touch base 2 weeks out or maybe even a week out from this point to see where we are. A couple of things that we're going to be looking at is the New York experience. When do they hit their peak, and when do we start seeing a decline? We will also have a lot more data from Kentucky that helps us track where we are and where we are going. This is further sacrificed by our kids and by our educators, but it's absolutely necessary. And I believe, because I have encouraged, that all of our school districts will extend that non-traditional instruction, making sure that our kids out there have learning activities and meal service. And let me just say that, yes, the learning activities can't compare to an in-class experience. But even if they can't, it provides a little bit of structure at a time of uncertainty for our kids out there. So thank you for everybody who's doing that. Second, new executive order today that mainly adds on to others. It expands our travel restriction to where out-of-staters traveling into Kentucky that aren't just passing through, that don't just stop at a gas station, are now going to have to quarantine for 14 days wherever they're coming. We have to make sure that we don't have folks that are traveling in, staying 2 days, and leaving because that frustrates everything that we are trying to do right now. Executive order also allows state, county, and city governments to hire back retirees if needed. We previously did this for first responders, remember, corrections, and others. We're now expanding it because we could see an entire part of state or city or county government ultimately in self-quarantine with this need to make sure that they have critical people in place. Third, starting tomorrow, there will be no overnight stays in our state parks. That is, none on the campgrounds and none in the lodges. Again, this is to make sure that we are all healthy at home. It's making sure that we're not creating opportunities for people to create a crowd, and we're not presenting a haven for those coming from other places to potentially bring their contacts. Listen, if somebody's got a family member from out of state and they want to come and ride it out with their family members, that's fine. But once you get here, you quarantine for 14 days and you don't go anywhere else. But we don't have during this period. People come in for a day or 2 days. It's no different than any other state's doing. It's a precaution that all states ought to do, and most states are doing. But again, we're going to continue to look at those areas each day where we can cut down on outside contacts that could come in and frustrate the sacrifices that we as Kentuckians are making. Next piece, I'm announcing that we are moving ahead with plans at the fairgrounds in Louisville, working to convert it to at least a 2,000-bed field hospital. We're going to use the National Guard to help stage that, believe the Army Corps of Engineers is helping us out with some work too. So our goal is to be ready when the surge comes. And that doesn't mean that we wait until we don't have enough space and then try to put this together. You know, we want to learn lessons from watching other states and what they're experiencing. I want to have this set. I want to have it fully ready. I even want to be able to lock the doors to it to reopen when we need it. I want to have it ready before we need one of those single beds. And if we don't need it, hallelujah. It means that the number of people that needed hospitalization fell within our healthcare capacity with a lot of other steps that we are taking. I want to say that I appreciate our emergency management group here in Kentucky that is leading those efforts, along with the Department of Public Health that is helping out with them. Next, we have our first report on what will be our initial release of select prisoners from our state institutions. I'm going to ask our Secretary of the Cabinet, who is a top appointed official in Kentucky, Michael Brown, to come up and to address that.
Thank you, Governor. Today, the governor signed an executive order, which, as he indicated, is our first step in addressing issues involving our inmate population. And it works both ways in these orders. One is to help protect those who are and have been incarcerated, and the other is to help protect those men and women who are serving on behalf of the state as our correction officers and other workers in our institutions. We are going through a screening process, and that order, today's order, will result in the commutation of sentences for 186 individuals, all of whom have been screened using criteria that CDC has put out, indicating that they may be vulnerable to and be more susceptible to getting the virus. These include respiratory ailments, heart conditions, etc. All of the individuals on this particular list fall in the category of C and D felons, and all of them have conditions that they have to uphold in order to fulfill the terms of the commutation. First, they'll have to be screened at the institution, medically screened at the institution prior to their release. We certainly don't want to put anybody out into the community that already would be testing or indicating symptoms of the virus. Next, once they're out, they have to have a residence to go to. That will be confirmed, and when they get to that residence, they'll be quarantined there for a period of 14 days. Furthermore, they have a condition that they can't obviously commit any other offenses or break any of the other conditions while they're out, or else the rest of their sentence can be reimposed upon them. The next step would be that we have pre-identified a group of, right now, 743 inmates, where if we complete our screening processes next week, these are all individuals who are within 6 months of completion of their sentence. And they will also be released upon the final check marks that we got to do next week. So that's another 743 that may be coming out. This is lightening the load on our correction system, at the same time protecting some of the most vulnerable individuals who are in the correction system. And after that, we'll continue our screening process to look at other populations that might be there. And I do want to say that even within the institutions, we've stepped up all of our efforts as far as sanitation goes. We're working on creating, even the inmates themselves are making some PPE, although it may not be medical grade, to help protect them, and we are imposing social distancing at our institutions as much as possible. Thank you, Governor.
Oh, don't take it all though. You got my notes.
Oh, we got yours? I don't want yours.
The population that is involved here are all C and D, the two lowest level of felonies. They've also been screened for offenses that are nonviolent and non-sex related. So, for instance, there are certain Ds and certain Cs that weren't eligible for this consideration. Next piece is a call to action. When we look at the personal protective equipment that we need, We have 3 different ways that we go about getting it. Number 1, we try to buy it, and that is harder and harder and harder. And I've said it before, just about every time that we or any other state has an order that we think we're going to get, the federal government buys it or it goes to them. It's a real challenge right now. Number 2, we work to create folks to manufacture it. And the more sophisticated it is, the harder it is with the intellectual property that's out there. But we're working through that. Number 3, we ask for donations. And we have put up so many different slides showing amazing donations that people have made. What we need right now, Kentucky, and I know there's a lot out there, is gloves. Is gloves for our medical professionals. And if you have gloves, we want you to call this number. This is the National Guard's main number. They are going to coordinate collecting as many as we can. I believe that there are at least 1 million gloves out there in Kentucky that people can live without so that our healthcare professionals can have what they need. We believe this is the next area where there's going to be a big run in the United States. We need as many of those donations as we can. So call the number if you've got it. Put it out on social media when you're able to make that donation. We need the help. All right, so let's get to today's report. But first, I want to go over kind of how these numbers, how we get the numbers that we report every day, and the challenge that is with them. So James, can you put up that slide? There are multiple ways that we get this information. So what I provide each day are the official numbers for the Commonwealth of Kentucky based on what's been received and confirmed by the Department of Public Health, which being represented here by Steve Stack's photo. So the first area that it comes in from are our labs. There are now over 32 labs that have done at least one test in Kentucky. But here's the challenge. Only 2 of them report electronically, which is the normal way that's reported. And a lot of these labs might be 6 months old, a year old, or have never done this type of reporting. So we have 31 different groups that are supposed to, but do not always, send data in to the Department of Public Health. And that data is supposed to be total number of tests, and then when there's a positive, it's supposed to contain certain information on it. But as you can imagine, with 31 different folks sending it in, most of which have not had to exist in this regulatory environment, the information that we get, first of all, we don't always get it from the lab itself when we report it. And second, it is not always complete. Second place that we get information are our local health departments. And there are, if you'll click that next one, 60 plus local health departments. Give me the number again. 61, see? Local health departments, each of which is doing their best, but each of which is also getting information from lots of different places. So when there is a positive, the local health department is supposed to send us demographic information for us to collect within the state. So just pause where we have right here. A lab, a new lab especially, may not be sending anything to the Department of Public Health. They may just be sending it to the local health department, which means we may just get something from the local health department that we haven't gotten from the lab. We may get incomplete information from the lab. We may get other partial information from the local health department. And what is one positive may look like 2, because it could be where the test was taken versus where the person is living. It could be that age is not on one and is on the other. There can be transcription errors. As you can see already, we've got over 100 players that we are getting information on and trying to match it up and do our best to make sure it's accurate. But that's not all. Sometimes we get information first from news reports. And at that point, we've got to figure out, do we already have that information? And that requires checking with our lab and going to the local health department. But that's not the only place. There are hospitals and healthcare providers, and there's a bunch of them all across Kentucky. So oftentimes, the lab is contracted with them. And the lab doesn't report to us, they report to that hospital, who then reports to us. And then we then have to go out and try to collect that information from the laboratories and the local health departments. So that is the process that we are trying to work on and work with for a type of pandemic that none of us have ever experienced. So for those that are upset that our numbers change or that we have to make corrections, I will tell you our Department of Public Health is doing their best. They're working long hours. I'm absolutely proud of them, and I will stand by them. And every day I will give you the very best numbers I can, because we're trying to give you numbers that are accurate as of 3 or 4 p.m. Some other states aren't doing that. They'll only report the previous day's number so they can try to work through them. So this is why you get numbers that we change and we go back and we try to correct and we try to deduplicate each and every day. So today's report starts with that. So going through, and we are trying to do multiple levels of audit right now. We've brought in some extra help. Going through our previous results, we've been able to find several duplications and a number of people who are out of state. And so our number from yesterday, before we announced today's, should be adjusted down to 670. That's after we removed those that were duplicated or were tested in Kentucky or reported in Kentucky but don't live in Kentucky. And so our number of new cases today is 100. So added to that 670, our official number of cases in Kentucky today is 770. And yes, if you called the labs, they would have different numbers. And yes, if you call the local health departments, they will have different numbers. There's only one place that you can get the official state numbers, and we are doing our best with all of those groups out there to get them to you every day as accurately as we can. Now, 100 is a lot of cases, but again, it's not 1.5 times what we had yesterday. It's not 2 times what we had yesterday. So we know we are in the slope that is increasing. These are type of numbers that we expect. In fact, we would expect bigger numbers. Now I can give you a partial list of new counties that we have, and remember, the public health departments and other cities announce at different times with different cutoffs than we have. And when I get to deaths, and that one's going to be hard today, it's going to include one at least that was reported yesterday out of a city that we hadn't confirmed. And so I can give you what I believe is 74 of the newest 100. We have 26 that had just come in right at the cutoff that we don't have that demographic information on. So on our list, we have 28 additional in Jefferson County. We have 6 additional in Christian County, 5 in Kenton County, 4 in Fayette County, and then we have 2 in Davis, Edmondson, and McCracken, and then we have 1 in Adair, Bath, Boyd, Boyle, Callaway, Campbell, Clark, Crittenden, Cumberland, Grant, Lincoln, Madison, Meade, Menifee, Montgomery, Pendleton, Pulaski, Scott, Shelby, Spencer, Warren, and Woodford. And can you go back to the slide about how we get the information? I just want to throw one other layer in there so everybody knows what we're working with. When you look at the labs over to your right, the amount of days it takes to get the results back vary widely with them. Our state lab is about 12 hours. U of L is really fast. They are typically within 24 hours. Quest, where there's a big national story about a backlog. I was asked about a backlog with the state lab, which we don't have. There's at least been a report out there that there's over 100,000, I think it was 160,000 backlog in Quest. They can take 7 to 10 days. And by the way, if you're taking 10 days, it's not terribly effective if you're asking people to self-quarantine for 2 weeks. And so even when we get a test that comes back, depending on the lab, it could be 10 days old. And it could be being treated as a presumptive given different symptoms, or sometimes people get a second test, which comes from a different lab that comes in. So this is what we face when we are facing a virus that has pretty much, at least to our knowledge, only existed about 4 months, and we are trying to ramp up capacity as much as we can. And so while the overall number of 100 seems like a lot, it's not escalating as quickly as we see in other places. But today is a tough day, a very tough day in the deaths that we have seen in Kentucky. At this point, we believe that we have 11 new deaths to report today. Now, those span from occurring on the 31st through today, but those tests often just come back. My understanding is at least all but one individual, and we're still looking at information from that individual, have other what we call comorbidities, which are other health conditions. That's what this virus does. It goes after people who have other health conditions. We'll provide an update on the where that these people are coming from, and remember that we provide information at different times than others. Our cutoffs are different. But we have a 65-year-old male from Fayette, a 62-year-old male from Pulaski, 49-year-old male from Boyd, 70-year-old male from Jefferson, 78-year-old female from Jefferson, 89-year-old female from Jefferson, 88-year-old female from Fayette, 77-year-old male from Fayette, 75-year-old male from Grant, 89-year-old female from Kenton, and a 65-year-old male from Jefferson. And we believe when Jefferson does its next updates that our numbers will be in line with them, except we hope it's not the case, but there might be additional deaths that occur by then. Folks, this virus is real. It's real. It's why we have sacrificed. It's why we have fundamentally changed our economy. It's why so many of you aren't currently going to work. It's why so many small businesses are shut down. It is very real, the toll that it can take on people. It's why we ask you to make sure every day that you're not having those additional contacts. It's why we keep asking you to do more and more. And with this weekend coming up, and I'm going to share other projections tomorrow, but with this weekend coming up and being beautiful, remember, we just lost 11 people today. 11. And these lag by about 2 weeks, right? I mean, if you think about how long it could take for symptoms to show. So let's recommit. Let's recommit. I know I say this a lot, but let's breathe. Let's take it in, and let's recommit to making sure that we do everything we can so that we don't have too many more days like today. Also want to mention that we are now seeing them in different institutions, and just like we are throughout the rest of the United States. So remember, that innocent contact that you could have, just trying to get together with somebody, thinking it's just two sets of friends, well, they can go back, maybe somebody go to work, maybe somebody talking to somebody else in a grocery store that then knows somebody that they see that works in one of these facilities. For instance, at least our information as of now is we have 3 positives of folks that are either at or work at Western State Psychiatric Hospital. We can only confirm 3. I think there have been others that have said 4. We believe 1 test is outstanding. 2 of those 3 are on ventilators. They are both in their 80s. This shows how quickly this can move, how we have to make sure it doesn't get into those institutions, and how everything that we do matters. So let's recommit. Let's know we wake up tomorrow. It's a new day. It's a new day that we wake up to address this coronavirus tonight. Before we go to bed, let's make sure we light our houses up green, because we lost a lot of people today. Let's make sure that that's showing the compassion to their families. If you want to express that compassion on social media, do it. I know the families are out there, and even if they're not in your city or your town or your community, we're likely to see it. But let's wake up tomorrow, and let's know that each one of those people that we lost would want us to do even better, even though we're doing well, would do even better as we move forward. We can do this. Let's stay at it. Let's follow the restrictions, and let's make sure that we protect those around us. All right, I'm going to open it up for 15 minutes of questions. I'll go one question here and one question on the sheet. I will give everyone one specific question in order. I learned that yesterday, and we will start today with Phil, and then we'll go this way.
Some of the stores, I guess, are asking for just like one person per shopping cart to come in or anything like that. I asked you yesterday about your conversation. Any new things from you as far as like behavior in certain stores?
Right. The question is about stores, and I believe Perry County put in an order on one person per shopping cart, and we have seen that. The goal there is to make sure you don't have whole families that show up, and oftentimes that could lead to socializing. We are looking at that. Our challenge is, one person per shopping cart. What does that do to the single mom that needs to bring, or the single dad that needs to bring their kid if they're going to get supplies? It may be that we look at a single adult per shopping cart, but folks, don't take your whole family. Don't take your whole family to any store. Don't expose your kids. Don't expose each other. Think about it. If one of you gets the virus, and you're going to have to at least self-quarantine, you want the other person to be able to be there to take care of the kids or to take care of you. Now let's think about those things when we make those decisions. I do believe that our stores are doing more and more as we go forward, and they're learning like us. I've been hard on a lot of them, and I will probably continue to be. Why? Because we got to do it right, and we got to do it better every day. Let me flip to some of the written. How many people have recovered from the coronavirus? So we have not been tracking that, but we are going to start. We're going to call through each and every person that we have documented to their public health department, and we are going to try to start tracking this on a daily basis. This is a bigger challenge because it takes an extra step on the back end, but it's a statistic that before now we were not actively tracking, but I do believe it's very important. We know the number's above 60. We know it's well above 60. And this is just tied in. What is the estimate on how many people have been tested for the coronavirus? So we've confirmed, I believe with what we have today, that we've confirmed somewhere around 12,000 would be a solid number. We believe that is somewhere between 17 and 25,000 based on the rates of positives. Joe?
So on the subject of the deaths today, we're seeing more and more stories from other states that can humanize these victims that died, put a face on the human toll of the crisis. And we've heard from Kentuckians who say they want to know more about the victims in Kentucky. Do you know why there hasn't been information released about those people? Is there a stigma people don't want to release that information, or are you concerned that if these victims remain nameless and faceless, there will be a human face on what's actually happening?
So if I could summarize the question, it's that in other states we've seen some stories on the actual folks that we've lost, which humanizes, makes it more real to people out there, and kind of why we haven't been doing that, and whether that's something that we believe would help. I think that I added that last piece. HIPAA prevents us from doing that without the permission, at least in my opinion, from the families. Any family that wants to share, certainly we'd like to show our population some of the amazing people that we've lost. But I believe that's got to be a decision made by that particular family. And if those that have lost want to share their stories, we want to help them to do that. Now, I don't think that we have asked any of the families in full transparency, and I think part of that is we've just been working really fast. But I do think humanizing it would help, especially as we see more numbers. We don't want people to be desensitized to the numbers, right? Because we see numbers every day, and it's almost just a how we doing, right? And it's much more serious than the how we're doing. Now, I think our green lights is something different than others are doing, and it's almost a way that we internalize it a little bit more. But I know it's a question, but I think it's a good suggestion. The legislature would pass a bill that would let the governor and the Secretary of State determine the manner of the election if it is still going on in late July. Do you support the legislation? Yes. If it comes to it, would you rather postpone the primary or take steps to find ways around in-person voting? First, we'd have to determine if we can legally postpone the primary any further. I know that there is already a constitutional provision that lets us push it back to where we did. We'd want to do a little more research about whether the emergency powers let you push it back further. I believe that the Secretary of State is looking at other ways of potentially voting. I think he is right to do that, and I look forward to any of those conversations. Mike.
The National Academy of Sciences sent the White House a letter last night citing limited research that seemed to suggest the virus could be spread through just breathing and talking. It could linger in the air. Is this new research guiding your thinking, and is it time to start thinking about advising people to wear facial coverings in public?
So the question is about a letter that some experts sent to the White House claiming that they think the virus can be spread through the air, at least at a greater level than previously thought. I believe one of the people that's been interviewed about it wasn't talking about walking around outside, but was maybe saying with his research he thinks he ought to wear a mask or something when he is at the grocery store. We are awaiting the CDC's guidance on that. I mean, they are the overall experts in the field. They have currently advised people who are well not to wear masks. By the way, people who are sick definitely ought to wear masks. And if folks are nervous and they have a non-surgical type of mask that is not taking that away from our healthcare professionals, then I certainly understand that. But if we move towards recommending that, we absolutely can have people using the respirators that our doctors and nurses need, or the surgical masks that we need. I mean, we can't be doing that. We got to make sure that if we reach that stage, and we have the ability to produce a lot more of just a type of mask that would prevent the exchange of certainly of droplets and others. That's where we would get. I mean, we still believe that even if these folks end up being right, that the major spread is certainly through droplets of the type that the flu also spreads. WFPL has asked about, and I owe them an answer on percentages on the national stockpile requested versus gotten. I've worked on that today. I don't have it for them. That's on me. I know you've asked for a couple days. I will continue to work to get you an accurate answer on that. Current hospitalization rate for those that have tested positive, we're going back through and attempting to get accurate data on that. Here's where it's difficult. That what we are seeing in some of our healthcare systems is actually a better rate than anticipated on days that people need to be in the hospital. So it's not as simple as you have the coronavirus, do you write it out at home or do you write it out in the hospital? It is now more of if you write it out in home, that's great, and you are preserving a bed for somebody who needs it. We're going to need a lot of healthy, strong people to do that. If you have to go to the hospital, if you're in that position, it's when can you get stabilized well enough to go home and ride out the rest of it at home. So there is that extra wrinkle in there that at any given time, if we call somebody who's positive and say, are you in the hospital? The answer may be yes or maybe no. But it is a good sign that the number of days required, at least in some of the systems, has been shorter than anticipated, and it's been shorter than the models that we have. Phil?
Any plans for a field hospital in Lexington, perhaps?
The question is plans on a field hospital in Lexington. We do have and are working on a hotel to use as a hospital in Lexington, and I believe there's some other systems working on some plans as well that I think we'll hear about within the next 24 hours. I don't want to jump out in front of their plans. Being asked by Morgan Eads from the Herald Leader, this is about the Bankers Association and realtors needing guidelines or asking for guidelines with the county clerk's offices for different things that they need. We have talked with the County Clerk Association. Their report that they are working with these two groups to try to figure out solutions about how, without in-person contact, that they can get the services that are needed. The optimal way this happens isn't the governor saying, you do this but not this, and you do this but not this, but it's the two groups together identifying the central needs and then coming to an arrangement where we can have as few people working in a building as possible. We can have no person-to-person contact, but the commerce, the thing that needs to get done, can get done. Joe.
I have a two-parter about GE in Louisville, the plant there. We've been told by workers that they have 300,000 surgical masks there that they use for workers who are building the appliances. Do you think that's appropriate for use of those? And secondly, we've now have bipartisan legislators, Republican and Democrat, from Louisville who have called for GE to close the plant for safety reasons. Do you have any update on your thoughts about that plant staying?
So two-part question. One is reports of surgical masks or large amounts of surgery. Is the report surgical masks or being used out at GE? The second part being, is there an update on, I guess, our position on closure or opening? Today is the first time that I've heard of a large level of surgical masks out there. That's something I definitely want more information on. I know a significant number of surgical masks are incredibly important to our frontline healthcare workers. So I want to get more information before I say I'm concerned, but I'm certainly interested in figuring out the facts behind it. We've been relying on the Louisville health departments, Metro health departments, their inspections of and their opinions on GE, that facility, and the steps that they've taken. We'll continue to touch base with them, but from our conversations, they are active. They are monitoring it, and we do hope, though, that there can be some level of agreement or continued talks between GE and those workers. Is the governor considering? Further. Can the governor's office give some response on Western State? I believe I did that. We can only confirm 3 of the 4 that they are asking on. If lawmakers do not confirm Governor Beshear's executive order reorganizing the state education board or pass legislation dealing with the board's appointees by sine die, what happens? So if they don't confirm the executive order reorganizing the state education board or pass legislation dealing with the board's appointees by sine die, ultimately I'll appoint new members to the Board of Education. That's how we'll deal with that. My hope is that they will come in and they will confirm those members. Listen, I understand some of the concerns that were raised. They're concerns that I'm not allowed to consider by statute, but especially with what we're in now, let's preserve the continuity. I don't think anybody can argue that these are very excellent educators, that from a matter of qualifications with Superintendents of the Year, National Teachers of the Year, former President of UK, that they are an excellent group, especially to evaluate the search for a new Commissioner of Education. I think that's pretty important right now. So what I'd ask is if they passed a one-year budget, confirm our appointees, let them serve out the year, and if they want to consider other legislation, I don't think it's necessary, but I'd say consider it at that time, and we'll argue about it once this coronavirus is over.
A woman from Boyle County contacted us and said that she and her boyfriend were tested, but the tests were lost. I know this is anecdotal, but I'm not sure if you received similar reports, and what would you advise us specifically?
Question is on a individual report that Mike got from someone who was tested and says their test was lost. This is the challenge with, just for us, 31 different labs. Some of them we have 1 test from. Some of them we may have 2 or 3. And what we saw are these pop-up centers trying to charge $250. I don't think they're valid. Based on what I saw, they don't look valid. They might have some contract with someone, and they might just have a couple supplies, but make sure if you're getting tested, it's connected to a healthcare facility, the state, a university, a reputable partner. When I talked about drive-up places, some of them are legitimate. Primary Care Center in Hazard is running one. They are a healthcare facility. That's real. University of Kentucky in Louisville, I think, have for first responders and their own people, some that are up. Those are real. But right now, no one is offering testing outside of the most vulnerable with symptoms and our first responders and healthcare workers with symptoms. If you are being offered a test and you don't fall into that category, think two things. Number one, it's a scam. And number two, if it's not, you're taking up a test while generally healthy that someone else desperately needs. And if you are sick, and if you do need a test, make sure you're going to a reputable provider. Let's see. I think I've answered. There's a question about King's daughter and folks being positive. I don't have the information on that. We'll work with Chad at WSAZ to try to get that information. Has the Amazon facility closed by the governor last month been reopened? Yes, that reopened, I believe, on the 1st. I wanted to make sure the governor saw our story about medical interpreters at U of L saying they're going unaddressed by leadership at U of L Hospital against national guidelines by continuing in-person interpreters. I had not read that story until I got the question. I have just read a little bit of it at this point and would want to touch base with U of L about what's going on there. But let me say, in response to the question, anything that doesn't have to be done in person, anything that can be done virtually ought to be done virtually. And I don't know if this can be done virtually. I again, having not fully read the story and knowing what's involved, and I don't want to step in front of U of L by any means of that. But I think we all agree, and they would too, that anything that can be done virtually should be done virtually. Take one more from everybody here so I can get through these.
Has Kentucky paused routine inspections of nursing homes?
Has Kentucky paused routine inspections of nursing homes? I think the types of inspections we are doing has changed. More so about dealing with the coronavirus, but let me get you an exact frequency on that, and I'll get that answer from the Inspector General themselves. If we have entirely paused them, I'm not aware of them, but let me make sure of that, and if we have entirely paused them, I'm going to fix that. All right, this is one that's going to be hard for me to answer. It says a number of people have asked me, and I'm wondering as well, Governor, how are you holding up during the coronavirus pandemic? I'm really bad at answering personal questions. It's hard. It's hard on all of us. There's the anxiety, there's the sacrifice, there's the loss. I'm the guy that has to get up every day and tell you if we've lost Kentuckians. And it's not easy, but I've never been prouder, and I said this, to be your governor. I see Kentuckians doing amazing things every day to do their part in this. And I could have never imagined, even though I wanted to be a governor that brought us together, that I'd be governor serving at a time when we need everybody. And when we have something out there that is so much bigger than anything that ever divided us. Everything that I tell to you all, I have to tell myself. And I think I say breathe to y'all because I have to tell it to myself as well. But I'm not doing this alone. I got amazing people around me. You met Michael Brown today, my chief of staff, Latasha Buckner, all the great people at DPH, all the wonderful state employees that are out there, all of our great hospital workers. I mean, we are surrounded by amazing people. And while I've got to come in here and do this job every day, most of the time, my orders require sacrifice from others. And so I'm going to be all right. The The question is, how are you? If you're not going to work and otherwise you previously were, are you taking care of yourself? Question to the frontline healthcare workers are you okay? And do you have what you need to be able to get up every day and to continue to go to work? I'm being asked about my reaction to Daniel Cameron. I think there was a release today, again, that dealt with abortion. I haven't read through it, but I'm just not focused on anything other than the coronavirus. And I'm not going to get involved in any type of argument or fight that could divide people in any way. My goal is to stay away from anything at a time when we all have to be together that could potentially pull us apart. The latest story on Kentucky Health News: Kentucky didn't cut travel as much as bordering states did last week. Some moving about were helping to spread the virus. I disagree. I think that national sources believe that our orders serve the exact same purposes as other states. Some other states say you can't leave your house, but for this, theirs don't say you absolutely can't be in a group of people whatsoever. I mean, we have different ways of going about how we're going to get there. I believe our orders have equal strength, and I think we're all seeing the same problems in compliance, and we're all talking about encouraging people. The story uses some cell phone data about how far people had to travel. Well, folks, if you're in parts of eastern Kentucky or western Kentucky, when you need to go to the store, it may be 12 to 20 miles away. It is not urban centers to where it is easy not to do that. If you want to go to the post office, and that may be the only place you get your mail, it is further away. And listen, in Kentucky, we said you can go for a drive. Don't get out of your car, but you can go for a drive. And if you can engage in social distancing, you can drive to a park and take a run. You ought to do that as long as you can do that. What's important to me isn't how we get graded by Wallet Hub or what type of cell phone data they pull out. It's that wherever we go, are we engaged in the type of social distancing that we are? Because if we can do that, we can keep our physical and emotional health in such a better place than having an order that, at least in name, says we're boarding up the house and no one's walking out for any reason. That's not what stops the spread of the virus. What stops the spread of the virus is we don't have contacts with other individuals, that we don't get within 6 feet from them, that we don't find ways to frustrate the order, that we all do our part. How many Kentuckians who have died of the coronavirus did not have underlying health conditions? We may have had our first today, and we are working through that. I would have told you before today it's 0, that everybody had comorbidities. We think we may have the first individual, but we need to make sure we drill down before we fully confirm that doesn't have a lot of known comorbidities. But by and large, when we look at the deaths that we have seen out of this, it comes for folks that have been suffering. We answered this one. And then what specific parameters am I looking at before making a decision to reopen schools to in-person instruction? So we're looking at a couple of things. Number one, we're looking at how quickly our cases increase, but also before we can open, we got to start seeing a decrease, and a regular decrease. Like, we got to get over what our peak is going to be, and we have to be declining at a rate where it would be safe. But even before we're going to hit that, we got to watch what other people's experiences are. With the way that this has hit New York and New Orleans and others, we ought to be seeing some models, though those models will likely be the large peak that looks like the no restrictions when we put up how we flatten the curve. Even if they flatten their curve, their peak is going to be, I believe, significantly greater than what we'll see. So our model will be a little bit different. And part of it, honestly, will be feel. It'll be relying on our healthcare professionals, and it'll be making the very best decision we can. But we're going to make sure that we make a decision that protects our students and our faculty and the rest. And there is a chance, there is a real chance, that we don't go back to in-person classes this year. I told that to the superintendents. That is absolutely possible at this point. We're not there yet, when we get at least halfway through April or a little later, we'll be able to make that decision. One last one.
The revenue bill that was passed yesterday, it had a provision on expanding absentee voting in the primary. Do you think mail-in voting is a realistic possibility for the June primary?
Question is, one of the bills that was just passed, the revenue bill, allowed for expanded absentee voting. Do I believe that mail-in voting is a real possibility for the June primary? Yes. I think it's a real possibility, and if under the law we cannot move the election, it would probably be if we are still dealing with the coronavirus the way we are today, I would not allow poll workers to go in person, and if we couldn't move it, that would be the option that I think we would have to take. We're not there yet, but if our numbers look like they are today, still escalating at that point, or if we haven't had the decrease, knowing our poll numbers are some of the poll workers are some of the most vulnerable, we'll do everything we can to protect them. And I do want to commend our Secretary of State, because I think when he was running, and I don't know this, you'd have to ask him, that he would say mail-in elections were something he disagreed with. But you know what? We're dealing with the coronavirus, and he is looking at being creative and trying to find a way to make it work. That's the no Democrats, no Republicans, just Americans versus the coronavirus. So I know I've gone just a little long. We will get through this. We will get through it together. We're going to have hard days like we did today. We had a hard day yesterday. And we may have a number of hard days in a row, but we can take it. We are tough people. We've proven it time and time again in Kentucky and in this country. Every day that we have a tough day ought to motivate us, ought to say the stakes are real, and the things that we're being asked to do, we can do. Now, this is our challenge. This is our time. Now, let's be a good neighbor. Let's protect one another. Let's care about one another. And let's pass this test of humanity, which means we change our lives for the benefit of people we don't even know and we may never meet. It's that we care about our fellow human being enough to where we will dramatically change our life and make our future economic security uncertain, because we care so much about other people. When we look back, I know that we will not only remember rising to the challenge, but truly answering that question of whether we put others above ourselves. That can make us a very special generation, and we're going to prove it when we defeat this coronavirus. Thank you all.
Good evening. I'm Kevin Christopher. We'll join Nancy Cox live in a few minutes, but first we want to let you know that the president is speaking, and you can catch President Trump's news conference live on MeTV 18.2, and we're also streaming it on the LEX18 Facebook page. The governor, in his news conference this afternoon, made it very clear that we're having another tough day here in Kentucky. We have 100 new coronavirus cases today, bringing our state total to 770. And there are 11 new deaths, bringing that total to 31. LEX18's political reporter, Carolina Buchek, joins us with more about what the governor had to say this afternoon.
One of the first things that the governor said today was that for the foreseeable future, possibly most nights, we will be having to light up our homes green. Of course, green lights have become a symbol here in Kentucky for when we lose someone to the coronavirus. And today we lost 11. So the governor is taking new steps to make sure that we can do everything that we can to save as many people as possible. First change, he's recommending that schools do not go back to in-class learning until May. Then he's requiring people who come here from other states to quarantine for 14 days. Overnight stays at state parks, that is no longer allowed. And then there are 186 inmates who will have their sentences commuted. They have been identified as more susceptible to getting this virus. And on top of that, 743 other inmates are being considered for release as well. All of them are within 6 months of finishing up their sentences. And then there's the planning portion. The governor wants to get a 2,000-bed hospital open at the fairgrounds in Louisville, just in case we need it.
So our goal is to be ready when the surge comes. And that doesn't mean that we wait until we don't have enough space and then try to put this together. You know, we want to learn lessons from watching other states and what they're experiencing. I want to have this set. I want to have it fully ready. I even want to be able to lock the doors to it to reopen when we need it. I want to have it ready before we need one of those single beds. And if we don't need it, hallelujah.
Another call to action. The governor says he is hoping for more donations, specifically PPE, and what they really need right now, gloves. So he's saying if you find gloves in your home, please consider donating those. Back to you.
LEX 18's political reporter, Carolina Buchek. As the need for donations increases during the COVID-19 crisis, there's concern about how to get resources to people in need and how to do it safely for those on the front lines. Nancy Cox has more about that from her home studio in Lexington. Hi, Nancy.
Hi, Kevin. On Wednesday, Governor Andy Beshear enlisted the services of Kentucky's National Guard, and that should help immeasurably. LEX 18's Michael Burke reports.
Supply inside Lexington's God Pantry warehouse is not the issue. It's how to get it where it needs to go safely.
We're being very conscious of the health risks that exist. And so we're doing more work today in emergency food boxes than we normally do. Hence the value and the wonderful support that the National Guard will help us with over the next couple of weeks.
70 Guardsmen and women called into action on Wednesday by Governor Beshear to assist God's Pantry staffers to help fill food boxes.
All of those boxes are handled in a way to ensure food safety.
Then lifted onto trucks of the respective agencies charged with delivery. Mr. Halligan admits there was no way to prepare for something like this, but being prepared for just about anything else has worked in the pantry's favor.
We've got inventory of stock today to be able to provide all of the services that we've historically provided.
Providing it now with a little help from their friends at the National Guard.
They will be doing internal work, packing emergency food boxes and senior food boxes.
Feels as if almost everything is an emergency these days. In Lexington, Michael Burke, LEX 18 News.
LEX 18 and the Scripps Howard Foundation are teaming up with God's Pantry Food Bank for the Hope Over Hunger project. We at the station are encouraging businesses to consider matching our $10,000 donation to help feed the hungry. If you need help or would like to support the cause, go to the website on your screen, lex18.com/hope. A Ruggles Sign company answered a client's request and is now making sneeze guards for businesses and retailers across the country to help stop the spread of the virus. LEX 18's Lee Searcy has the story tonight from Woodford County.
You know, on a daily basis, you got Bath and Body, you got Pink, Uniglow, you got Claire's, K Jewelers.
Tim Cameron's company makes the signs we see everywhere.
Primark, Chico's, Soma.
But for now, Ruggles Sign Company is making these.
It's a sneeze guard. I mean, somebody walks up and you got a barrier between you, it's clear.
It started with a call from a client, the DHL shipping company, wanting better protection for employees and customers at its service centers.
And they reached out to us and said, hey, we have a need for a sneeze guard. Can you help us?
In 24 hours, Cameron's employees created a design and put the prototype into production.
It's 3/8 acrylic. It's pretty rigid. It's made to be freestanding so they can set on their counter.
His skeleton crew now has orders from other big companies.
When DSW reached out, I think the talk was like 2,600. When Nike reached out, they said they may have a need for 1,500.
Cameron's team is on it. Operations Manager Brad Turpin.
Load the material, which in this case, 3/8 inch clear acrylic, and basically hits go, and the laser will go and cut it precisely the dimensions that it's supposed to.
Once assembled, the sneeze guards are packaged and ready to go. DHL picked up its finished order today.
This whole pandemic's made me think about, what we can do in crisis type situations.
Ruggles Sign Company, around since 1946, is looking into the future, making good things happen.
And I think it's more about what the new normal is going to be once all this passes, and when people start showing back up at stores and restaurants, what's it going to look like? And I think you may see more of these sneeze guards. But it was really not all about the money. It's about helping people. And if we can do something to help rid the world of this virus, that's what we're all about.
In Woodford County, Lee Searcy, LEX 18 News.